Welcome back to the AME Food Safety Show. You hear that? The rock and roll world is reaching back to us. We're now about 55 years later from the 1960s, and we see our grandparents, our parents, now paying the price of the rock and roll generation. Let's talk about what's happening today with psychotropic drugs that are being prescribed to our people. First slide. There's a study in Norway that says that psychotropic drugs, or psychiatric drugs, lead to the death of over 500,000 people a year over 65. That is something that people are consuming either because they've been recommended by a medical professional. Psychiatric, by the way, is both a physician and a person that can deal with psychology or the brain or the effects of mental action. Let's think about that for a minute. Next slide. What are psychoactive drugs? It's a psychopharmaceutical or psychotropic chemical combination which changes the way the brain responds to stimulus. And we translate that into a human's mood or their perception or their consciousness. It alters the consciousness. You see all those bottles there? Those are manufactured by legal pharmaceutical companies. If you watch TV, anybody here watch TV? And you look at those cable channels with the fascinating topics, almost all of the advertisements are with drug companies. And at the beginning, it's a typical pattern. They show people walking, having a great life. Then they pitch their product, which will change their lives. Then they address very lightly and with a happy little voice on the potential side effects. And then at the end is the pitch. Ask your doctor. Everything will be wonderful. I disagree with all of that. The pitch as a generalization. Yes, it goes through a medical professional. Let's look at why. Next slide. Are there medical reasons for these medications? I ask yes. I ask why. I'm asking yes. Is there an overprescription? Yes, potentially. But here's what we're saying. The National Institute of Mental Health has estimated that 26.2% of Americans over 18 are now on a diagnostic regime, a treatment regime for whatever the prescription. Is that too much? Is our society 75% plus or minus healthy and 25% are sick in order to have them, enable them to function in our society? Is that where we are right now? I'm asking everyone, both the people taking the pills, people manufacturing the pills, and people prescribing the pills. I personally talked to physicians, and I asked one of them, I said, how many patients would you like ideally per month? He said, Andy, I only want one patient, and I want to charge them $25,000 or $30,000 a month so I can survive. That's what one physician told me, a psychiatrist. So what I'm thinking is, why are they overprescribing? They want to make more money, in my opinion. I could be totally wrong, but maybe everyone that walks in their office needs a pill. I am fighting that movement amongst the medical profession. Next slide. Who is prescribed psychotropic meds? Well, almost 1/5 of Americans, according to this particular survey, that mood-altering or medication daily helps them make it through their miserable lives. I don't believe the United States is that miserable, that we need to take a pill to survive. You might disagree with me on that. These are legal administrations of, primarily, you're looking at drugs that are related chemically to either cocaine or heroin. Now, you might disagree with that. Andy, no, this has this and this has vitamins. Well, let's look at it. You're also looking at alcohol, nicotine, and other legal type medications. They're mood altering. Let's look at what this particular researcher found. He found that West Virginia, Rhode Island, Kentucky, and Alabama had very high usages, over 25% in many cases, and so, just near it. The lowest was Alaska, Wyoming, and California, believe it or not, California. Here's the deal. Why are these people being prescribed, and why do they take it? You can be prescribed all you want, but they can't jam it down your throat. You're taking it because you're getting a result. Next slide. Here's a very interesting chart. It's a little complicated for me to walk through, but I'm going to tell you. Here are the principal medications that are being prescribed. Ritalin, Adderall, and some of these others. Those are known as stimulants. Antidepressants. You've heard of Prozac, Zoloft, Celexa. If you don't know those names, just watch TV. Antipsychotics, people that have psychotic episodes. And these are only known by those particular people. Abilify, Zyprexa, the names go on forever. But what is the effect? The effect is they're changing their mood by medication. Self-medication, which I'll talk about in another segment, is another area altogether. There's no medical supervision. Next slide. So, psychotropics, what are they doing to us? They are a medical prescription use. Here's the challenge I have, and I'm challenging the medical profession because I used to teach med school. Either you're giving too much, too many, you're giving it too soon, or you're holding it on for too long. Those are my objections. Why are you saying that, Andy? You've got a medical professional monitoring these people. I agree. There's medical monitoring. But the question I ask, once you start one of these regimes, when are you going to end? And they'll look at you with a goofy face and say, well, until the patient's better. 9 times out of 10, these people will never end. They will start that regime and they'll be on there forever. If they stop, they'll have a psychotic reaction, then they've got to put on new medication. So, the movement to fight or reduce the use of psychotic medications, particularly in foster children. You think, Andy, this is crazy. San Jose Mercury News in 2014 recorded that a lot of people, and these are people, they're not objects, foster children are being prescribed these medications. In my opinion, they might have emotional challenges, but I want to know how long they're going to be on it, how much are they going to be administered, and isn't it too soon for a child? Just because you want to control them? Next slide. All right. I've already talked about cable TV, how they own the media. If you don't believe it, watch television, listen to the radio. They'll pitch their products. Big Pharma owns the media because they pay. They can tell CNN what to do. You don't believe me? Watch CNN. See all those commercials about medications. You'll see how they influence these media directors, program managers. It is absolutely a travesty for our modern society to allow these undue influences. Next slide. All right, it's my last slide. I have a few minutes I want to spend on it. In 2010, this is some good data. I have the link right there. This is an excellent study. You want to look it up. And I have the WordPress link at the bottom of this slide. $16 billion on antipsychotics. $11 billion on antidepressants. $7 billion to treat hyperactivity disorder, ADHD, which, by the way, was never in existence as a diagnostic treatment, and until the pharmaceutical company that invented that and applied it toward children came up with that acronym. It's completely invented to apply adult medication to children. So what is the issue with all that money? Is it absolutely necessary? I had to argue with some people it is. But there's a growing body of research that says, and this I want to leave with you, that a lot of these medications and these FDA clinical trials have proven that these highly addictive, highly narcotic medications with very loose prescription guidelines are just as effective as sugar pills. Placebos, if you want to call them that. The bottom line is the human psyche is a mystery. People do what they want to do. They seek for the easiest path of resistance. They seek to get high because they like that euphoric escape. I argue with everyone listening and watching this show. Enter these regimes very carefully. Monitor them very carefully. Monitor the medical professionals, especially with children. And I ask you, I plead with you to minimize the use of these narcotic substances. And I tell you, I don't believe you need to use them. as much as being used generally. 26% of a state hooked on drugs that are handed up by pharmaceutical companies? I doubt it. I ask you people to gain control of your lives and take a sugar pill once in a while and calm down. Thank you very much. I look forward to the next segment.